Hello everyone, my name is Angela Mugumba. I'm a midwife and we are looking at neonatal sepsis. My presentation today is about prevention, and in specific, we are looking at infection prevention and control. So in this presentation, we want to know what is infection prevention and control. And all nurses, midwives, and doctors, this is not something new. We are reminding ourselves of what infection prevention and control is. So looking at the definition, infection prevention and control, it is a practical approach. It is evidence-based, and it's an approach that prevents the patient and also prevents you, the health worker, from being harmed from infection. Willis and Chandler had a quote about antibiotics. Antibiotics have become, as they were saying, they have a quick fix for hygiene in settings of minimized resources. So, for example, in Uganda, instead of preventing the infection, all we do is go for antibiotics. So it is quite an interesting quote to think about. Why is infection prevention important to our neonates? Neonates are very vulnerable to infections. Just like our pregnant mothers, they are also vulnerable. And also these babies are vulnerable because they have a low immune system. So they can't fight infections on their own. How can you protect the neonate from getting infection? First of all, you, the midwife, you, the nurse, you, the doctor, it's very important to wash hands. Keep your hands clean. Where you're working from, is it clean? Let's have our wards clean. The equipment you're using, is it a monitor? Is it a fetoscope? Where are you placing this baby? Is it the baby cot? Let us have our equipment clean. Aseptic techniques that are in theater, are we observing these techniques? Are we keeping our working areas sterile? The equipments we are using, are they sterile? So observing the aseptic techniques in theater is something important. When we look at antenatal care, midwives, are we talking to these mothers about maternal hygiene, which is something vital for our babies, most especially the unborn babies? Preventing unnecessary vaginal examinations. Yes, our students, you're eager to learn. We know that you want to learn the vaginal examinations, but how are we doing it? Are we well conversant with the vaginal examination that you're doing? And is it this mother that you're performing a vaginal examination on, is she in labor? Is it the right time to have a vaginal examination done? So it is something important to look at. Managing the attendants. We have very many attendants on our ward. Let it be in the NICU, let it be on the postnatal ward, in the labor suite. We have very many attendants and caretakers. So it is our duty. It is my role as a midwife. It's your role as a midwife, a nurse or a doctor, to manage the attendants on the ward, because they are also a source of infection to our babies. So looking further, what do we mean by clean hands? Why should we clean our hands? Why is it important to have clean hands, first of all? It reduces spread of microorganisms from person to person. It can be me, the midwife, to my colleague or to a patient. It protects you as a health worker, and not only protecting you, but it also protects your colleague, it protects your family back at home. And something else, how do we wash hands, or how do we keep our hands clean? You can either use alcohol hand gel, or you can use the soap and water. It is in two ways. And something else to note, it's cost effective. Hand hygiene is cost effective, and it's the only way we can prevent infections to the neonates. So the emphasis here is that we should all wash hands. And why would we wash hands? What should we observe? These are the 5 moments of hand hygiene, and this is to all health workers. Before touching a patient, you have to wash hands. Before doing a clean or aseptic technique or aseptic procedure, wash hands. In case of a body splash or exposure, like in the labor suit, you can have like a splash of liquor or blood. First wash hands before you continue with the procedure. After touching the patient, you're done with the procedure. First wash hands before you do anything, either documentation or before going to another patient. Please wash hands. And after you're away from either the ward, you're from the patient's surrounding, it could be the ward or you're going home, still wash hands. So let us observe these 5 moments of hand hygiene, which is important to each one of us. So in the next 5 minutes, I'm going to request a volunteer to take us through or to demonstrate to us on how we can wash hands, or the steps taken to wash hands properly. So still with infection prevention, we are looking at cleaning our wards, but how are we going to have clean wards? When we look at this slide, we are talking about segregation of waste, and those are the medical waste. And we all know what the 4 buckets are supposed to contain. We have the black, the red, the yellow, and the brown. We have the black for non-infectious waste, and the red for the highly infectious waste, the yellow for the infectious waste, and the brown bin for pharmaceutical waste. So we still have a problem as health workers. We don't adhere to waste segregation, because you find each and every kind of medical waste is mixed up in these bins. But we have the SOP that is attached next to these bins. So please follow them, and they can guide you accordingly. So still looking at clean wards, we, the health workers, together with the support staff, the cleaners, it is in our duty to see that we are working in a clean environment, and at least having once a day, like once in 2 weeks or once in a month, to have thorough cleaning of our wards. As you can see, we have our midwives. They are working together with the students to see that they're in a clean environment. And this still continue. We still look at how to mix JIC. JIC has different percentages. So you as a health worker, you as a student, you should know how much you're supposed to mix the JIC that you're going to use either for disinfecting the instruments, or you're going to disinfect the working surfaces, or you're going to use it for cleaning on the beds and other places in the ward. And how do you do this? You have to protect yourself using heavy-duty gloves, aprons, masks, and boots. So it is a team, as you can see. It's not you, the health worker alone, but involve each and every member of staff in that department. And you see that the cleaning goes on. So still looking at infection prevention, we are talking about putting on the right clothing when you are attending to a patient. First, protect yourself, then you protect the patient. And with this slide, we are saying every health worker that comes into the hospital wear short sleeves. Why is it short sleeves? You're going to prevent infection to yourself and also to the patient. If you have long sleeves, it is better you fold those sleeves, but not working when your sleeves are below the elbow. Still with clothing and dress code, ladies, it has been observed mostly in the labor suit when you're performing vagina examination. The nails are long. Then our nails are painted. Some of us come on duty with artificial nails. So it is really absurd because we are preventing infection. So let us have our nails cut short and clean. Our hair tidy and clean. All long hair should be pinned up and washed and clean. No jewelry, that is very important. Mostly, some of us come to the wards and someone is washing, has a watch around the wrist with the ring. So no jewelry is allowed when we are caring for our patients. And also having closed shoes on. It is very important to you as a health worker to have closed shoes rather than open shoes. Preventive antibiotics or prophylactic antibiotics is also something essential in infection prevention, mostly to the mothers who are going for cesarean section, whether emergency or elective. These mothers need the antibiotic before the operation. So within the 30 minutes, it is our duty as the nurse who is escorting this patient to theater, remind the doctor in case he has forgotten to prescribe, and we administer that drug to the patient. A mother who has history of premature rupture of membranes is also entitled to have this antibiotic because it is going to reduce the risk of infection to the unborn baby. The same applies to a mother who has preterm labor. She needs this antibiotic because of the risk of infection to the neonate. Vertical transmission, that is mother to baby transmission. Is this mother infected? Still, when we look at the antenatal care, when the mother is still pregnant, is this mother having a history of urinary tract infection? According to the investigations done, in case a urinalysis has shown that this mother has a urinary tract infection, give her that antibiotic. And in case there's like evidence of a vaginal discharge, an abnormal vaginal discharge, is it yellow in color? Is it green in color? You've seen that this is an infection. Start this mother on antibiotics. Or in case the discharge is offensive, begin this mother on antibiotic. Previously, we have talked of preventing unnecessary vaginal examination because we see it as a risk of neonatal sepsis. So the vaginal examinations should be conducted once a mother is in labor and she has come on the day of admission. But when you perform this examination, you as a health worker, you as a student, you've been supervised by your superior, by the midwife. Please have these findings, the vagina examination findings, documented in the patient's file. And then when you repeat an examination, try to document it. That is every 4 hours as you look on the mother's pathograph. In case a mother has early rupture of membranes, still you have to document. Documentation prevents unnecessary repeats. So when we do the documentation, it is going to prevent the unnecessary vaginal examinations. And as earlier, as the previous presenter had said, that documentation is very important. So trainees, I'm talking to the students who are in the room. Trainees should learn to use the simulation model. As you can see on this slide, we have the simulation model. This model is going to help you practice rather than practicing on the mother herself. So it's very important to you, the trainees, to use it before you are confident of doing a vaginal examination on a mother. So let us take a few minutes, a break, and we go through the vaginal simulation model or to practice on it, and then we shall resume later. As we had previously seen that we have very many patients on the ward, we want to manage our patients. As managers on the ward, let it be a nurse, let it be a doctor, it is our responsibility to see that we manage attendance as we are caring for our patients, because we have seen that the source of infection on the ward. It is your responsibility as a nurse while delivering a service to the patients to tell these attendants, to inform them that this is no time for the attendants to be on the ward. It's time to deliver, either give drugs, either do wound dressing, but not with attendants on the ward. And during the COVID time or COVID period, there was a study that was done on the role of attendants and their behaviors. So we found out that the attendants have a big role. Where are you, a nurse? You're supposed to come in and help and give the bedside nursing. These attendants are the ones who are doing all these. They have a very big responsibility. But it is we are responsible to inform them on hand hygiene, on how to take care of the babies, how to take care of the mothers. But this is our responsibility on managing them to see that we prevent infection to our babies, the unborn babies, and the mothers also. So at this time, we are going to have a film. It will be talking of how these attendants, how the flow of attendants in and out of the ward, and how to manage them. So thank you so much for listening.